And
Yep.
what happens when it doesn't metabolize actually?
Is about estrogen metabolism. Estrogen basically has three different metabolic pathways. We call it 2-OH, 4-OH, and 16-OH pathways. The 2-OH is the most effective and safer pathways that we want most of our ladies to go through, that their estrogen goes through that pathways. And about 70% of the estrogen in our body, if you have a healthy pathways and metabolism, it should be about 70% through the 2-OH. The 4-OH is a little bit of a riskier one, but that we want just only a little bit, maybe about 10 to 15% to go through the 4-OH, because it can cause like a DNA damage to different tissues of the body. And the last one, which is the 16-OH, that's when we see basically if that is a little bit on the higher side, we always see a little bit like a carcinogenic substances. We see things like fibrocystic breast or like fibroids in the ovaries. So that basically, if the 16-OH is too high, there's a lot of risk for like tumor formation in the body. So, and that's one of the things that it's very important to detect early on, to just find out that what is the pathway. So how does that estrogens is basically very metaboliting in the body, and is which pathways. Are we more into the 16-OH and 4-OH, or are we more toward the 2-OH, which is like the more specific ones and the safer one actually.
Order your Dutch Plus test via our shop online and learn more which detox pathway is your estrogen going.